Hey everyone, how you doing? It's Dr. El-Amin. How's everyone? I just got out of OR, and like I said, I'm just going to be following up with some Facebook Live videos of discussing, pathology for educational purposes and teaching people and my patients about what we do. As you know, today we did labrum surgery, as I talked about earlier, and we're going to talk about how this relates to some of the pro athletes that we know of and watch. So the first thing we're going to talk about is what is the labrum. I'm going to flip over. All my patients' identification has been blocked, so there's no way of looking at that in compliant with HIPAA, but it's been given permission to discuss it. Let's get started. So this is basically, I don't want to dwell on this, but this is the actual shoulder scope, what it looks like. Quickly, I want to pan over to this one because this is a better image, but what you're seeing here is this is what they call the ball and socket. This is the glenoid, that's the humeral head, and on the border is the labrum. As you can see here, it's frayed and it's torn and it's detached. And as we go further down, you can actually see where it's torn off and actually caught inside the joint here. So when you clean it up, it looks like that. As you can see, again, that is the glenoid, that's the labrum, and that's my probe. And you can see I'm pulling on the labrum, and you can see it pulls off. And that's the head. So when you throw or you do overhead activity or you try to use this hits up against this, and there's nothing to block it. So that's why it could either dislocate or you could have actually pain. So you can see as you clean it up, you can see a nice little area of divot where there's a problem there, and that needs to be fixed. So that's that's the labrum. Behind it is the capsule. So we tighten it up, forming a labral repair and a capsulorrhaphy, which means tightening the capsule. So we do that. That's a great picture here before I get started. That's a great picture actually preparing for that. As you can see here, this is detached. This used to be there. That's what Andrew Luck had, something similar to what he had. I didn't see the pictures, but I know this is what they consider a labral tear. So you can see actually we're drilling here and getting ready. We'll put our suture in, and this is really cool because this is all arthroscopic with 2 small incisions. And as you can see, you've reattached the labrum back to the glenoid. So you can see that. So you can see the bumper's there, the capsular is tight, and you can see the ball and socket is back in alignment. And so as we go down, you can see that we needed a total of about 3 anchors to do this. So you go from this picture to that picture to that picture. That's what a labral capsular surgery is. So now this usually takes for me, about 16 weeks to get back. Sometimes we can get back a little sooner, but this is pretty much how it is. Why is that important? Well, it's important because we know that there are quarterbacks that get this done, or receivers, or football players, or NBA players, and stuff like that. And so you sort of kind of want a time when they're going to get back so you can rehab them the right way and get back for the season. So what does that mean? Well, we all know Andrew Luck was out for almost a year with this. So typically when that happens, there's something else that's going on. Either it didn't heal, you got an infection, when the anchor's pulled out, you just don't know. But what I do know is that those things happen. And so this is Dr. El-Amin giving a little bit of background on what labral tears are and capsules. And these are really fun surgeries because they really help people a lot. And it's unbearable because you can't sleep at night. You have problems, your shoulder dislocates. If you reach for something, you get a jolting pain, and you put it back on and it heals, and people go back doing what they need to do, including throwing a football. To help everybody has a good day, and we'll talk to you soon. Bye.